Welcome to Simple Local Life, everyone. It's Jen here, and I am back at Earth Angels Home Care in Bridgewater. And I just want to say Happy New Year to everyone, and Happy New Year to Tamara.
Happy New Year to you as well.
Oh, good. You had a nice holiday?
I had a wonderful holiday. It was
quiet.
nice.
It was nice, wasn't it?
Yes.
It's good to have a little time and just kind of eat all the cookies, do all the things.
And now lose all the weight.
Now lose all the weight. Get back at it. And we're getting back in the saddle here at Simple Local Life. And I'm really excited because we're continuing on with our Caregiving Talk series here that we're doing with Earth Angels Home Care. And the timing for this one just couldn't be perfect. It's Alzheimer's Awareness Month.
Yes.
January is Alzheimer's Awareness Month.
Yes.
Okay.
Yes.
So we kind of wanted to touch today on a couple topics. And if you're watching and you have any questions about Alzheimer's or about dementia, by all means ask away. Or if you've had any experience with it in your family, I know sometimes these are kind of private conversations, but if you want to share anything, please leave a comment and just let us know, or let us know where you're watching from. Earth Angels Home Care is watching. That's great. That's handy.
Yes.
So with January being Alzheimer's Awareness Month, I think we're kind of looking today at some of the more frequently asked questions that you guys hear, and I think that some of the public has around dementia.
Right.
And so let's just start there, Tamara. What is dementia exactly?
So dementia is an umbrella of symptoms.
Okay.
So it's a set of symptoms that affects the brain,
Okay.
the cognition in the brain. It's much like an umbrella. So when you hear a diagnosis of cancer,
Yes.
there's various types of cancer.
Yes, yes.
So it's a set of symptoms. So dementia is your umbrella term, and there's various types of dementia out there.
Okay, so then the question I had was, and I was doing some reading and researching a bit and looking at some of our notes we were going to talk about today, but then, so Alzheimer's then, what, I guess the difference between Alzheimer's and dementia. Alzheimer's is under that umbrella?
Yes, so the umbrella is dementia, and Alzheimer's is a type of dementia.
Okay.
So there are over 100 types of dementia, and the list goes on and on.
Oh,
but
wow.
Alzheimer's is the most prominent type of dementia, and there's
Okay.
about 70% of the dementias out there are Alzheimer's disease.
Oh my,
Yeah.
oh wow. The numbers are always sort of startling, isn't
They
it,
are,
when you
yeah.
start talking about them.
Yeah.
And I know one of the big numbers that you guys that we've talked about before and that are pretty commonly known, but there's like 17,000 people here in Nova Scotia.
In Nova Scotia alone.
Just in Nova Scotia.
Yes.
Living with dementia.
Right, and there's
Wow.
about 540,000 Canadians living with dementia as well.
Oh my gosh.
Yes.
So these are kind of, if it's not something that your family or that you are being affected by right now, what I like about this series is that I think we're kind of educating the public on some of the facts. Sorry. They're open here in the office. That's okay. Is some of the information just so that you can kind of be aware yourself. I'm learning so much through this series, and I feel like that awareness piece will be so helpful for families as they look to the future, or even just as they might be something they might be wondering about right now.
Absolutely, yes. Yeah.
So what are some of the signs that people are looking for when it comes to determining, I guess, if you feel like maybe a loved one or a family member might be struggling with dementia, or you're starting to see some signs? What are those kind of warning signs?
So we really touched a lot on the last caregiver series about what to look for when
Yes.
you're coming home on the holidays.
Yes.
So it's not just memory loss.
Right.
Dementia is not just memory loss. There's some language problems.
Okay.
There's some change in your functional ability. Being able to do that familiar task that you've done over and
Right.
over and over.
Yes.
It's an impaired judgment, so your executive function is not the same. You might not be able to dial numbers on a phone or drive your
Okay.
vehicle the same kind of thing, right? It's changes in your behavior and your personality. So it's a
Right.
multitude of things. It's not just the memory loss.
Right.
Yeah.
So that's kind of like the first thing people think about sometimes is, they can't remember things. But it really is a lot of other signs that I think family members might be quick to kind of just push off or not want to really not want to get too concerned about. But there's definitely then some of those, if you're starting to see some of those, like you said, those kind of thought processes and different things like that, and numbers, and just a recall, but little different changes in behaviors that you should be watching for.
Yes.
Okay. So I guess the next question I have around this too, and I think a lot of people do, is that it's some of this, and I think the tendency is to kind of chalk it up to a normal part of your aging,
No.
So dementia is not just a normal part of aging.
No, so dementia is not a normal part of aging. So TPA Snow explains that, we lose about 0.5 to 1% after the age of 25. We slow down in our processing.
Okay.
And by the time we hit about 75, we've really slowed down a little bit. So that's not normal. So we're slower to process things and make decisions. Our ability to, the fight, flight kind of, information, or recall a name or anything like that.
Okay.
It's a little slower to process, so that's normal aging.
Okay.
It's when you can't get that information to come forward. That's not normal.
Okay. Yeah. Okay. So dementia itself then is not a normal part of aging.
No.
But there's certain signs then that you would see, that you'd be watching for, that then you would be thinking, okay, is this something we should start
investigating a little deeper.
Investigating.
Yeah.
Okay,
Yeah.
good.
Yeah.
And I guess then carrying on is, I guess the next question too, and I know a lot of people think about this. We see dementia a lot. Sometimes our family members get concerned, whether it's Alzheimer's or dementia, that kind of run in families, or people start to wonder that. So can you kind of predict what's going to cause dementia? Is there like a set of, is some of it your genetics or your family line? But I'm assuming there's other factors as well.
There are a multitude of factors. So about 5% of your dementias are like what are called familial. So it's a genetic disposition. It runs in the family. But most causes of dementia, there's a lot of treatable causes. There's smoking is a big factor. Exercise is a big factor. Diet is a big risk factor. Diabetes, anything like that are huge risk factors.
Wow.
High blood pressure, those are all risk factors for, because you think, healthy heart, healthy brain.
Yeah.
Well, if you're getting your physical activity, you want to keep your heart healthy, you want to keep your brain healthy.
Wow.
Right? So
that makes so much, it always makes so much sense, doesn't it? We just got to keep moving, people. Eating right, move more.
Stop smoking.
Stop
Yeah. Wear a helmet when
Yes.
you're out doing some exercises, so you don't do any damage to your head if you fall.
Staying social, and those sort of things.
Yeah, doing some mind games and keeping your brain active. All those things are preventable causes, right?
And it's kind of encouraging, if you do have family members who've gone through it. I think there is a lot of fear there that that you are going to get it. But I think being equipped with the information and the knowledge around how you can try to prevent it, or kind of be proactive in your lifestyle. So things and the smoking number, I know wasn't it something like 45%? You have a higher rate, isn't it?
It increases your risk factor by 45% if you are a smoker. Yeah.
That is incredible. Yeah. Like, what a number. So I mean, there's so many reasons why you might want to consider stopping smoking for your overall health, but certainly when it comes to dementia, that number is just pretty startling.
It's staggering.
It is. Yeah. So all of those things that we mentioned, of course, taking care of yourself and being active, and take even just care, like you said, wearing helmets and things. Right now we're in winter with this ice everywhere, and
we'll see everybody walking down the street with helmets on.
Well, hey, a slip and fall can be pretty dangerous. So that's all good information to have. And I guess then the next step, I think, is we're kind of talking about what kind of signs and how it's diagnosed, but then I guess, or what kind of signs to look for, but then I guess, how does that diagnosis happen? So it's not just a family member going, oh, I think mom or dad might have Alzheimer's or dementia, but then is there a step you can go through to get it diagnosed?
So there's no one single test that you can do to diagnose dementia. It's a multitude of, it's a process of elimination. So you're looking, you should first see your family doctors. It's, a lot of taking your medical history, doing a lot of testing. It might entail a CT scan or a PET scan, some blood work to rule out anything reversible. So a lot of times a low iron can mask you know, a memory problem. Your thyroid out of whack can mask somebody with a memory problem. Stress actually can mask something. So it's ruling out all of the things that are treatable or reversible, and it's a process of elimination. So it's a complex thing. It takes quite some time to actually come up with the diagnosis of dementia, and it's, you know, it's doing that investigation process. It's talking to your family members. What things are you noticing? So it's not just a matter of walking into the doctor and saying, "There's the rubber stamp. Yeah, here you go." Yeah,
it's not that simple.
No, it's a history. It's a physical. It's, you know, some blood work, maybe a CT scan. It's quite a bit of stuff too.
And then through that, then then they can make a diagnosis?
Absolutely. Yes. And sometimes, depending on the presentation of the dementia, it might take more than a family doctor. You may need to go see a specialist, like a geriatrician or something. Right?
Oh, this is good to know too, and good to kind of keep, if you are a family member or loved one caring for someone and you have some suspicions, you know, it would be a great idea just to kind of keep some notes about things you see, dates and notes about changes you might see.
Absolutely.
So I know here at Earth Angels Home Care, you guys do a lot of your clients here are struggling with dementia, or you're working with loved ones family members whose loved ones are struggling with Alzheimer's or dementia. So what is the role, I guess, with home care can you provide assistance in ways? I know you can, but
we absolutely can. So we here at Earth Angels, we specialize in dementia care. You know, we have certified trainers and coaches, and all of our caregivers are, you know, it's mandatory that they're trained in the TICA SNO positive approach to care, and we're always here. There's trained coaches and to coach them through their situations. Okay,
so if you're kind of taking note of things, or it's after the holidays, and if you did see, as we talked about in our last video, some changes with mom or dad or grandma or grandpa, and you feel like maybe now it's time to go to the next step, I would encourage you to give them a call here at Earth Angels Home Care and just kind of set up a meeting and have a conversation. There's so much information and such a process to go through, just to kind of figure out where your loved one is at and what they might be able to provide for you as far as care. And sometimes having those conversations early is really helpful, isn't it?
Absolutely. It's better to be prepared. I did an assessment the other day, and when I did the assessment, the assessment was so neat because it was a proactive assessment. There was nothing really outstanding or alarming right now, but they wanted to have a process in place for them aging, and so going forward. So it is good to have that process.
I love that. And, you know, just talking about some of what we were talking about earlier, you know, some of the practices you could put in place, and I know that Earth Angels, I think it's Roseanne mentioning probably that what's good for your brain is good for what's good for your heart is good for your brain. And that what a great idea is to do that kind of proactive approach, and kind of even just in setting up making sure that your loved one or someone in your family is sort of taking care and note of some of those things.
Absolutely, absolutely, and it's great. It's great to have that, because a lot of times going into the doctor's office, the doctor is going to ask you, you know, what have you noticed? And if you have all those notes in a list, it's going to be much easier than sitting on the spot and saying,
trying to recall
what do I remember?
When was that? So, Tamara, I know we've mentioned this before, but you are a certified positive approach to care trainer and coach.
Yes.
Well, that's wonderful. Yes. So, Tamara is here training you're training the caregivers that you guys have here in Bridgewater.
Yes.
Wonderful. And so, if someone did want to set up an in-home assessment for someone, is that those are complimentary? Are they?
Yes. There's it's no obligation, no charge.
Okay. So, you could call them here and ask them to come to your loved one's home or come to your home and just even assess the situation and have a chat and just kind of get that conversation going.
Absolutely, absolutely.
Because maybe they're not at a time where they're needing assistance, but it's good to start that sort of conversation and then see where they're at. Well,
and that really gives us a solid baseline for the future when we're going in.
That's important too, probably to gauge any changes that you might see.
Yes.
Wow.
Yeah.
Well, we have so much more to cover on this topic, and like we said, January is Alzheimer's Awareness Month, and I'm really happy that we're still carrying on this conversation with Earth Angels Home Care. So we're going to carry on some more of the kind of frequently asked questions and some of those topics in our next video, which will be on January 22nd. And if you have any questions, again, just call them here at the office.
902-530-6205.
Thank you, Tamara.
Brooklyn's waiting.
Yes, she's waiting. And someone else has been patiently waiting here as well. Thank you. So thank you guys so much for watching. And again, if you have any questions, even just private questions, you might want to send along, and I'll make sure to get Tamara to help you with those. Sure. Well, thank you so much, Tamara, for all of this, and we'll see you guys next time.
Great.
Bye-bye.
Bye-bye.